Nisha Kurian, and I am a physician in internal medicine and pediatrics. Working for the Institute, we get the opportunity and the pleasure of taking care of patients who would definitely not get health care. With education and repetition and the patient seeing how concerned you are about certain aspects of their health makes them realize, hey, maybe I should be concerned about that too.
The Institute for Family Medicine is a charitable, not-for-profit organization formed in 1999. Through strong community partnerships and collaboration, the Institute for Family Medicine has reached out to vulnerable populations, children, adults, the working poor, the elderly, and the disabled, populations in this community that face significant barriers to obtaining quality medical care. Through innovative and cost-effective programs, the physicians and nurse practitioners of the Institute go into the community and work to eliminate those barriers, bringing quality primary health care services to the vulnerable populations.
Virtually all the programs that we've developed within the Institute have come as a result of someone in the community coming to us with a need, a real gap in care. We take great pride in being able to address those needs and to fill those gaps, and to do so effectively and efficiently.
Because many individuals face significant barriers to obtaining medical care, including language and the lack of transportation, the Institute for Family Medicine has developed programs that are highly effective at bringing health care to people in their own communities. A great example of this is through their school health-based programs. By working with 10 area school districts and sending family nurse practitioners and physicians into the schools, the Institute for Family Medicine benefited nearly 1,700 children last year, providing health care and health support services. These services range from physical examinations and vaccinations to the diagnosis of acute and chronic illness, and preventive programs directed at reducing unhealthy behaviors in youth. Bringing health care to children in schools reduces student absenteeism, it keeps kids in the classroom and feeling better, and that improves their opportunity to learn.
One district came to us with the distress flag flying. They had over 50 children who were missing some vital immunizations that the state requires to prevent the outbreak of disease. These children were about to be put out of class because they were missing these immunizations. The school district had tried everything they could, but parents might have 2 jobs, or they might have a job where missing a day means they lose their job. We were able to work with the school district to go into the schools, get the children taken care of, and no one missed a day of school.
A lot of times the kids get sick at school. They're taken right over to the health clinic and being able to be seen right away rather than to have to wait for 2 or 3 days to get an appointment, and then from that appointment to be able to be seen, get them there, and then try to figure out a way to get medication on top of it. It's really very challenging for our parents, a lot of our parents, to try to make sure that their children's health needs are taken care of.
Bringing medical care to the vulnerable populations served by other social service agencies is another example of the services and collaborations that define the Institute for Family Medicine. The St. Louis Crisis Nursery is dedicated to preventing child abuse and neglect and serves as a safe haven for infants and children. To assure that children served by the Crisis Nursery have their health care needs met, the physicians, nurse practitioners, and physician's assistant of the Institute go on site several times a week to the various crisis nursery locations.
Over a year ago, when we were in desperate need of continuing our physicals, I met Dr. Dave and told him that we were in a situation where we really needed some help to get these physicals done. And I'm really pleased to say that at that first meeting, within about a half an hour, Dr. Dave was on board and committed. He didn't want our kids to go without having physicals. If the Institute wasn't involved, many of the kids here at the Crisis Nursery wouldn't be receiving medical care. So that's how critical this relationship is. The Institute for the Crisis Nursery is a true partner that cares about our children and wants them to be as healthy as they possibly can. And so they are committed to providing these physicals on a regular, ongoing basis so that the over 5,000 kids that come to the nursery every year can live a normal, productive life and be healthy.
Reaching out into the community, solving problems, bringing medical care closer to where people live, work, and go to school. No program demonstrates the Institute's commitment to these principles any more dramatically than its work with La Clinica. La Clinica is a neighborhood clinic in South St. Louis providing low-cost, quality medical care and serving primarily immigrants and refugees. La Clinica, which serves nearly 8,000 patients each year, was on the brink of closure in 2006 when the Institute for Family Medicine stepped up to help with medical care and overall management of the clinic.
Since Dr. Campbell has been here, we've had many positive changes. We have a better organization, better services, and a better schedule. The Institute for Family Medicine and La Clinica are both helping the community. If the Institute for Family Medicine were not around, there would be no La Clinica. We wouldn't be serving the community, the Latino and immigrant community, those without insurance, and the working poor.
Since its establishment in 1999, the Institute for Family Medicine has made considerable progress in addressing the healthcare needs of some of the most vulnerable populations in the St. Louis area. Nearly 40,000 individuals were served in the past year alone. Through collaboration and strong community partnerships, IFM looks forward to continuing to build relationships that lead to accessible medical care services for those in need. The medical, nursing, and support staff of the Institute for Family Medicine is dedicated to the mission, dedicated to serving the vulnerable, and dedicated to continuing work to provide these services in a cost-effective way. But by its very nature, the cost of providing these services is greater than what those being served can afford to pay. We hear every day about the tremendous cost of health care in this country. Lack of access to health care services results in health problems going undiagnosed, untreated, and with greater complications. Lack of access to primary care services leads individuals to seek care through costly emergency room services. Bringing quality health care to vulnerable populations makes the entire community healthier and saves the entire community a great deal of money. Continuing the programs of the Institute for Family Medicine depends on your help. With the financial support of our caring community, the Institute can continue to effectively and efficiently deliver quality medical care where it is most needed. Continuing the programs for the Institute for Family Medicine depends on your help. With the financial support of our caring community, the Institute can continue to effectively and efficiently deliver quality medical care where it is most needed. On behalf of the Institute for Family Medicine, I'm Bonita Cornute.